Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Jacqueline Sharp, and she is the Area Director for Arkansas's American Foundation for Suicide Prevention. Jacqueline, thanks for being here.
Hi, thanks for having me.
So tell us what the American Association of Suicide Prevention is.
Sure. So our organization is a grassroots, volunteer-led national organization. We were founded in 1987, and we were started by a group of loss survivors and researchers, because at the time we weren't studying, the question, is suicide preventable? And so here forms AFSP, or the American Foundation for Suicide Prevention, and our mission is to save lives and bring hope to those affected by suicide. And at the heart of us is we are the largest private funder of suicide prevention research globally.
And research is a huge part of what you guys do, right?
Yes, ma'am, it is. It is truly at the heart. So I do a lot of fundraising events. We do about 12 annually, and that fundraising helps provide grants, research grants that are provided globally to study suicide, suicide prevention, and mental health. And all of that research helps to inform the prevention education that we provide to the public all across the nation.
And what are some of the things that these studies target? Are there key factors?
There's a lot of different things, a lot of studies. You can look at afsp.org/learn, and you can pull up different videos from our researchers that we have funded previously. But we've spoken to, as a chapter, a couple different researchers. One is doing a study over sleep and its impacts on suicide. So, it was a great study to look at, how much sleep should young people get? And when they don't get that sleep, what are potentially the risk factors around suicide for that? We've had individuals talk about contagion. So we have a researcher right now that is going across the country and looking at communities where we see contagion happen. And contagion is when we see one person die by suicide and then we see multiple people die by suicide in the same community. Are there factors that contribute to that? And what can we learn from that so that we can as communities potentially stop that and help prevent contagion from happening, which was very, very fascinating. And then we have a researcher right now that's looking at social media. Often when I'm out in the public, that's the first thing I hear from people is, well, it's social media. And I'll often respond with, we just don't have enough data on that right now. We know that it can be harmful, but we also know that it can be a protective factor. So we have a researcher that's looking into the impacts of social media and suicide.
And is that a specific one coming up this summer?
Yes, it is. So we have that coming up, and our researcher is Dr. Mark Senior, and we'll be doing what we call a research connections. So I think these are just incredible programs that we put on, where what we want to do is we want to connect communities with AFSP funded researchers so they can hear kind of in real time what we're learning through our research. We have people that fundraise thousands of dollars to go towards these research efforts. And so to be able to connect them back and say, thank you, and this is what you are doing is huge. And so he's going to be talking about on July 24th, at noon at 12:30 p.m. We'll be talking about changing the narrative on suicide, how news media, social media, and hip hop artists can help us to prevent suicide, which is pretty cool.
Yeah, it's so interesting. And tell me about the BOLD goal. And that was formerly called Project 2025.
Yes, ma'am, it was. So that was AFSP's, and it still is. It was our goal to reduce the rate of suicide by 20% by 2025. Well, 2025 is right around the corner. And we created that goal pre-COVID. COVID kind of changed the script on a lot of those things. And, but the things that are part of the BOLD goal are still what we believe to be highly impactful. So the things that you have in the bold goal are healthcare is one of the areas of focus, firearms is one of the areas of focus, corrections, and then we also have emergency departments as well.
And there are tools for the ER staff part of this. What does that mean when you say tools?
Yeah, great question. So, what we do is we look at a lot of data. So we know that individuals that go into emergency department rooms that are high risk for suicide, 30 days post, that's their greatest risk for having a reoccurrence or another attempt. So what ways can we help with that? And then just knowing that some ERs do not have access to suicide screening software. And so in collaboration with, I think, the Association for Emergency Room Physicians, American Foundation for Suicide Prevention created what's called iCare 2. It is a program that is free. It's a tool that is free for emergency department physicians to use to help assess and screen for suicide risk.
Can eye care too also be used in, say, like a primary care setting too, or is it just for ER physicians, healthcare providers?
Actually don't know the answer to that. I'm going to lean towards that needs to be used just in emergency departments. Now, I do know that we have some other tools that we encourage physicians to use in primary care settings. But as far as eye care being used in the primary care setting, I think it's only for emergency departments.
But you are working with the American Academy of Pediatrics, so that is a little bit different too than the ER healthcare side of things.
Very much so, yeah. So I believe in 2022, our president declared a national health risk for youth here in the United States, a crisis in mental health. And so the American Academy of Pediatrics and our organization came together and created the blueprint for youth suicide. And so within that project, we have Project Echo. So this is something that's happening all across the nation where the American Academy of Pediatrics and the American Foundation for Suicide Prevention are working in tandem together in their chapters and in their areas to really kind of target some ways that we can help have impact on mental health and suicide prevention for youth. And so the Arkansas chapters have been working together on a project where we're helping to train pediatricians in, if you bring a child in and they assess high risk for suicide, having that conversation with parents about safe storage around firearms. So here in the state of Arkansas, over 65% of all suicides are by firearm. And so as an organization, we really want people to understand the importance of safe storage and educating people on just, really understanding that when individuals have access, they're at higher risk. And so this training is being provided through both of our organizations. And then we're also providing them with gun safes to have in the clinic to give to parents who say, I don't have any way of storing this. And really just kind of training their staff as well on how to have these conversations.
And there is also a portion targeting correction facilities. What does that entail?
Yeah, that's a great question. So that was new just like a couple of years ago, and we piloted that in 2023. And we had 3 different corrections facilities here in the state of Arkansas that participated in that. And we went and trained their staff on suicide prevention education and trained them to be presenters so that they could present to other staff members. And then also talk to them about, with some of the rules and laws and regulations around, if you have an incarcerated person who is high risk for suicide, I think the law states now that you have to check on that person every 15 minutes. A lot can happen in 15 minutes. And so maybe taking a look as a correctional facility, are there some things that maybe need to be adjusted to really help be impactful and to prevent suicide amongst those that are in their prisons? And so we've been working with those corrections facilities and then expanding that program as well.
Well, Jacqueline, there's an extensive amount of research and work that you guys are doing to help Arkansans and frankly everyone on the planet. It's incredible at the links that you're going to study and to make the world a better place. Tell me what you want the healthcare community, our community partners, our audience to know about your organization in terms of resources and the steps that they can take in order to put some of these things in practice or in their workplace. I mean, what do you want them to know?
Yeah. So, I think that the biggest thing that we want people to know is that you're not alone. There is hope and there is help. And we all play a role in this. I think that's the most important thing when I'm talking to healthcare providers, when I'm talking to people, organizations within the community. Each of us plays a role in this. And so what I want to encourage people in is maybe you've always done things a certain way. But maybe those things should be changed to try to help address the need. A great example of this is my primary care physician. I went in to see him and they handed me a suicide risk assessment. I'd never been given that before. I've been going to a doctor for many a year now, and it assessed for suicide risk. And at the bottom it had, the phone number and all the things. And I just happened to ask him, I said, why did you feel it necessary to do this? And he said, I lost a colleague and I had no idea. And I really felt like post-COVID that we might have people that were maybe at higher risk for this. And so I wanted to make sure to make this a part of my daily practice. And so I think looking at things like that, how can you be a part of the change, be a part of the help? How can you be part of the solution? Is really, really critical and really, really important. The other big thing I want people to know is that when we go out and we talk to the public, there are a couple things that we tell people. We have a presentation called Talk Saves Lives, and that's just kind of the gist of what we're doing. We very much believe, and research shows, that talk can save lives. And it's all about training people on how to have those sometimes awkward and uncomfortable conversations for those that you love. And then the other two things that are so important for people to understand is that time, giving someone's brain the time to get past that suicidal crisis, that moment of crisis, makes all the difference in the world in saving someone's life. And then distance, making sure that someone has distance from lethal means those are the two saving tools that we know through research. So time and distance are going to be crucial in suicide prevention.
Well, Jacqueline, thank you for sharing the message of your organization and educating us on what not only you're doing, but what they can be doing to make a difference as well. Thank you.
Absolutely. Thank you.
And that's it for this episode of AFMC TV. Thanks for watching. Have a great day.